The intake is the beginning of the relationship between the client and the practitioner, and it is an important stage. According to Keegan, during this process, there are 5 core outcomes that should be achieved. Number 1, establish the relationship of a working alliance. Number 2, establish and agree on ethical boundaries. Number 3, check that the psychologist's approach meets the needs of the client. 4, generate comprehensive client history, reasons for seeking help and the desired outcomes. And 5, appraise the psychologist's suitability for working with that client. Chris initially contacted me via phone call as he'd heard I was an experienced sports psychologist who'd worked with coaches in professional football before. We quickly set up a meeting via Skype for later that day. I chose Skype as a call because I wanted to establish a good relationship with Chris from the outset. I believe a face-to-face meeting wasn't possible, so in that way, by seeing his face would allow him to see the sincerity of my warmth from facial expressions and gestures. Also, during this initial consultation, I wanted to portray a genuine attitude for his well-being, a want to help him, and showing that I was non-judgmental. I also wanted to show empathy by following and grasping what his needs were, by active listening, summarising and paraphrasing his words. And once these traits are established, it makes for a strong working alliance. I mentioned that with my code of ethics as a psychologist, that all of our conversations would be confidential. I also discussed that our relationship would be terminated once the goals had been met, and that I would require full informed consent to be signed if he was happy with the content. We began to form our relationship by establishing my philosophy as a practitioner, being fallibilism, as I'm flexible in my approach, I believe in do no harm, I'm cautious and deliberate. I question each method and tailor it specifically to the client's needs and critically analyse data. I told Chris that I would offer full informed consent, including both strengths and weaknesses of the theories used. I told him that I would individually tailor the sessions and treatment for him, and it would be a fully agreed process. I wanted to glean some context and history from Chris, so I asked him about his previous experience in sport and to date. Chris told me he was currently a football coach. 2 years ago, he retired from a long career as a professional footballer, took his coaching badges, and began a role as an academy coach. 3 months ago, he returned to the EFL Championship club, where he'd made his name as a player and was still idolised by fans there, to begin his first role as the first team manager. With his playing record there, expectations amongst fans were high. Chris was provided with funds to buy several new players, and the board were expecting the club to be challenging for the playoff, but so far it had not gone to plan, with the team in the relegation zone. During this discussion, he revealed that he was under a great deal of stress trying to live up to his fans' high expectations of him, and he struggled to find his best starting 11, formation and tactics. His initial tactical and selectional decisions proved disastrous, resulting in heavy defeats. He's since tried tinkering with these and has a wealth of data from sports science team, but he told me that he finds it overwhelming and seems to be suffering from paralysis of analysis and can't see a way forward. I asked Chris about his expectations and goals. Chris said that he was reluctant to open up about how difficult he is finding this to his coaching team, which is why he's come to me for some help. I asked Chris what he wanted as a result of these issues, and his main goal was to be able to make confident decisions in choosing his starting 11, formations and tactics. During this process, I asked questions, recorded the information given. Chris had already outlined the presenting problem being decision making. I asked him what he thought was causing it, and he replied that his decisions haven't helped the team succeed, and they are now in the relegation zone. I asked him to go back to his days as a professional footballer and tell me more about that. He spoke with enthusiasm and clearly relished those days. I asked him what his goals were when he began sport, and he replied that he wanted to be the best. And then asked if his goals had changed, and he said no. I asked about his family, parents, siblings, educational background, his perception of psychology, family involvement in sport, and his current support system. None of the answers he gave were alarming or warranted clinical support. stating that he has supportive family and friends and that his home life did not present itself to be an additional factor in hindering his decision-making abilities. His health is generally good, although he has some trouble sleeping. I asked him to elaborate on a little with a few probing questions, and he answered that his mind races for who he has to pick for his starting 11 and how he can improve upon the last performance, as he's drifting off to sleep despite being tired. I asked him what effects he thinks this interrupted sleep has on his performance, and he replied that he knows he needs a good night's sleep to perform better, but he struggles getting to sleep because he's stressed about work. His eating habits have changed slightly, and he says he's lost a little weight. I asked about alcohol and drug use, and he mentioned that he has a couple of beers every now and then, but nothing significant, and he's never taken drugs. We concluded our chat with pleasantries and said our goodbyes. Van Oudenhove and Verteman 2000 argue how important the intake process is and how it should be something that precedes the helping relationship. Keegan notes that most important influence on the effectiveness of psychological support is the quality of the relationship itself. After this initial consultancy, I completed a checklist to enable myself to make sure I had covered all the relevant areas of intake. I felt happy that there were no areas remaining that needed clarification and that we could go ahead as we had a good rapport. He was also forthcoming with information even at this early stage. We were both satisfied at this point that we had the underpinnings of a good working relationship. I would ensure that my ethics and philosophical views were the foundations and underpinnings of our relationship. I would also continually keep records, be reflective of my own practice, and provide supervision and monitoring throughout the process. A needs analysis uses a variety of techniques to assess, measure, and understand the client's psychological needs with a view to working out how best to help them. Number 1, attempting to diagnose the client's issues. 2, identify the etiology producing these issues. 3, assess the impact of the current behaviour. And 4, offer a prognosis of what changes are needed. In order to gain a coherent overall picture of Chris's needs, I would conduct a combination of techniques to glean information. I would conduct semi-structured interviews with Chris using planned questioning, and I would also be able to respond to the new information. This does rely on my ability to ask both direct and responsive questioning. Responses would be recorded. I'd also use informal chats to gather information from my client. This would take place around the club or from any moment that arises with coaches, team players, board members, the sports science team, and Chris himself. The benefits of this technique of information gathering is that they can occur in any given convenient moment and in any comfortable environment. However, the weaknesses to these informal chats could have a risk to confidentiality and having an unofficial tone could reduce my ability to steer the conversation in certain directions and certain topics, in this case, in Chris's decision-making ability. I'd also give Chris questionnaires tailored to his beliefs on his own decision-making ability and stress levels and compare these to statistical norms. The benefits being that questionnaires are usually quick and easy to complete, providing a numeric and scientific analysis. However, a questionnaire doesn't allow for findings that I wasn't looking for, but hopefully with the semi-structured interviews and the informal chats, then there'll be enough information gathered. However, this numeric value from the questionnaires will allow me to ask Chris the same questions after the intervention and compare the statistics to see if there was an improvement. Once these techniques have been conducted and recorded, I then synthesize the information, building up a better overall picture of Chris and what is needed for him. Nizu and Lombardo in 2004 defined case formulation as a process of hypothesizing causes, mechanisms and outcomes of the client's presenting issue or problem. It's the description of the client's complaints and symptoms, or goals and barriers, as well as an organizing mechanism to help the psychologist understand how the client's situation came to be. Assessing the responses to questions and informal chats, it was obvious that Chris had not necessarily been making bad decisions, but the team and coach felt like he was changing his mind too frequently about the starting 11. This led me to think that Chris had self-doubt in making confident decisions. The questionnaire supported these findings, suggesting that in fact he was fairly indecisive at this time, as his results were outside of the parameters of a confident decision maker. He also scored higher on the stress questionnaire than social norms. From the techniques used, I understood that Chris's decision-making ability was hindered by his view of others' perceptions of him. His stress levels were above the norm, which also affects decision-making abilities. This cycle of stress and decision-making needs to be broken. Choosing a support strategy is the process of a course of action, for example an intervention or a treatment, that is selected from possible alternatives to allow for the real-world meaningful change for that client. The choice needs to be effective, theoretically appropriate and logical. It needs to be slow and deliberate decision-making process by the psychologist. So whilst also taking my own cognitive bias into consideration and with the evidence given from the needs analysis stage, assuming that Chris has given me real information rather than folding into social desirability, I could conclude that he's stressed, he has a lack of confidence in his decision-making ability, stress being a symptom of his poor confidence or decision-making and also hindering his ability to make informed decisions. I plan to work with Chris and construct a suitable checklist for him to use for him to make confident decisions. The idea being that with clear steps and structure for his decision making, he will become more confident over time, thus reducing his stress levels in turn. Planning an intervention or treatment can be defined as the intended sequence of procedures and treatment, a tentative plan. Keegan suggests that sports psychology intervention plan is like a roadmap containing desired end goals, milestones, the broader strategies and specific activities for the pursuit of the client's agreed outcome. After reading previous case studies on similar issues and reading about decision making, I know that most people rely on a heuristic approach rather than deliberate or effortful. It's evolutionary but leads to errors in complex tasks. So in Chris's case, I would like to make his decision making slower and more meaningful and make him apply more effort to his decisions. We are also influenced on social pressures. The ASH experiments have replicated findings to show as such. Chris has mentioned that he feels pressures from fans and board members. With a procedure to follow, he could justify his decisions and become more confident about them. I also need to be aware of my own cognitive bias, heuristics and logical fallacies that affect decision making, and although we can't really overcome them, we can minimise their impact. I have also taken into account that his seemingly poor decision making of late may simply be down to a bad run for him. Perhaps the fact that his team is in the relegation zone may be because of team factors such as poor cohesion, as there are several new players, different skills, or simply going back to a mean reversion and they're not playing as well as normal at the moment. I would explain to Chris that in this unpredictable environment such as football, formulas work better than human intuition, so I recommended creating a checklist. In this case, I'd plan to design a checklist for decision making with Chris using a successful previous model. This would allow him to have ownership of his treatment and enable him to learn tools to create ways to resolve further similar issues. I'd explain to Chris why we're doing this based on the research that I've done, and to make Chris realise that his decisions should follow a slower thought process, which will enable him to use data-driven decisions from the sports science team, for example. I'd also point out that this technique isn't necessarily a guaranteed fix, although it's been proven to work with other individuals in the past. If we find that it's not working in this case, that we could tweak it. I want to really make sure that Chris knows that I'm working this to make it really individual to his needs and requirements, as he's an individual and what works for others may not work for him. In order to create this checklist, I'd ask Chris to think about these things. 1. To put himself in others' shoes. 2. Consider any repercussions of his decisions. 3. Develop empathy. 4. Recognise the role of skill and luck. 5. Get feedback. Keep a decision-making journal. 6. Create the checklist, which would avoid his tunnel vision and help you understand the wider context, which would need to be brief, simple. It'd need to be general enough to allow for any varying changes, but specific enough to guide his action. And 7. Perform a pre-mortem. Ask himself where his decisions have gone wrong before or where they might happen in this decision-making. Once the checklist is created, I would ask him to keep a decision-making journal as he follows the steps. Once the checklist for decision-making has been agreed upon, Chris will execute this as a strategy. Any alterations that need to be made can be made. We recognise that it is a learning process, he'll need to practice it, and it will take time to become effective. I'll continue to monitor and assess his progress, and he'll also be completing a decision-making journal. As Chris is using his checklist, after he's finalised his decision for his starting 11 and formation, I'll ask him to complete questionnaires on stress and decision-making once more and compare the results back to the first. I'll continue to monitor and assess throughout the season with these questionnaires and through semi-structured interviews and informal chats about views of his progress. Once he feels as though he can use his checklist independently, or that he no longer feels like he needs my help with making confident decisions, then our relationship will be terminated. Keegan defines quality assurance as the maintenance of a desired level or quality in a service or product, especially by means of attention to every stage of the process or delivery. I would ensure that I kept good records throughout my work with any client, keeping a journal myself so that I can analyse and reflect using accurate details. In this case, I recognise that I could have gone down the route of dealing with Chris's stress levels, using positive self-talk or mindfulness, for example. Although they were explored, I felt as though his character would react better to a more structured treatment. Further support could have been given in this area, should his stress levels continue to be present. Also, as previously mentioned, the team itself could have been the actual reason for the poor performances, and so some work on cohesion, teamwork, or even performance ability workshops could be explored. However, more information would need to be sought for these to be delivered.